who's asking me question?
My mind is blown now with all this. I'm still floating somewhere in Neptune.
Hi everyone, welcome to a fresh new episode of Court Crimson Chats. I'm Ankita and here with me is my sister Anuja. Today is a very special episode for us because I have my wonderful friend Dr. Abhishek with us here. Welcome Dr. Abhishek on board.
Thank you.
Yeah, so Dr. Abhishek is a practicing oncologist and he's based out of Mangalore. Apart from being a wonderful doctor, he also takes keen interest in addressing and discussing pressing issues like poverty, education, and menstruation. And since October happens to be Breast Cancer Awareness Month, today's topic is breast cancer. So let's get started. The first question which we would like to ask you is that since a lot of girls in their 20s and 30s, they feel that breast cancer is something which develops later on in life. So do you really feel, or what is it? What do you have to say about it?
Yeah, so this is a common question that we generally get asked when we go for any talks or generally when we go to colleges and other things. But the thing is that breast cancer mainly is seen in the age group of 40, 45 and above, generally. But around 5 to 10%, I would say some 7 to 8% to be precise, of the breast cancer occur in less than 40 years. So off late, especially off late in the last probably a decade or two, we are seeing more breast cancers in younger population. Mainly those breast cancer are of a little bit, aggressive histologies. And mainly we see if they are having a family history, generally in those patients, in those families, the younger girls or younger women, they get these breast cancers. So breast cancer is not a disease of the elderly anymore. It is also seen in younger population. That is why it is very, very important that we spread this awareness not only to the elderly population, but also to the younger population.
Let me tell our viewers that Dr. Abhishek happens to be my ex-colleague as well. So if you remember, Abhishek, when the mammogram got installed in our hospital, so we had planned for the mammogram screening for women or for all the women employees above 40. Yes. But then I think I had approached you and probably Dr. Santosh that, I am hearing a lot of cases below 30 or, in the age group of 30 to 40 who are developing breast cancer. So what about them? Because I feel there is a different protocol. You get an ultrasound and then you do a mammogram. There's something to it. I'm not very sure with the protocol. So yeah, as you rightly said, a lot of people within the age group of 20s or 30s who are developing breast cancer.
Yes.
I have a question. When it comes to fibroids, they say that fibroids mostly develop around the same age as well, after 35, 40. This is largely speaking. And the reason gynecologists, they say that it is because of the hormones, excess of hormones in our bodies. And when women don't get pregnant and have babies, that is how the hormones manifest in their bodies. So is this something similar to breast cancer? Does reproduction have anything to do with breast cancer?
Generally, when we talk about the risk factors of breast cancer, more exposure to estrogen in a woman is a risk factor for breast cancer. Now, that can happen in two instances. So it is an early menarche. That is generally if the woman has an early menarche. That is if he starts menstruating at the age of say 9, 10. And late menopause. So generally menopause occurs around 40 years. Suppose say a woman has a menopause around 45, 48. So if you see the overall duration of exposure to estrogen, so during the menstruating period, the estrogen levels are high. If that duration is more, the risk is slightly more. So if the duration is less, the risk is less. So if a woman has attained an early, menopause, the risk is less. If the woman starts menstruating at a slightly later age, the risk is less. So if the woman childbirth, that time, estrogen levels go down. So that time the risk is slightly less. So in these are things, mainly estrogen is the one that is driving, the hormone related breast cancers.
Got it.
So, would you say that women should actively avoid supplements or food that boost estrogen in our bodies?
Not exactly, because every food, we cannot pinpoint and tell.
Yeah.
Basically, it is the intrinsic estrogen that is produced within the body that is
Okay.
mainly responsible. So
Okay.
outside food,
Okay.
if they take that, contributes a very, very, very small, fraction, which it could be negligible. So mainly it is within the body, the hormonal variations within the body that drives the breast cancer, hormone-related breast cancer.
Okay, because we do see a lot of supplements for feminine reproductive health, say Shatavari or Ashwagandha and such pills. So they don't
Yes.
really have they don't really have a direct effect to developing symptoms of breast cancer.
Yeah, not direct effect, but whenever you are taking any supplements, it is always better to check the content. Because if what I told you is a dietary supplement, if they're having daily food intake, in that the amount of estrogen that is present is very negligible.
Okay.
But if they are taking supplements that is rich in estrogen, then they have to be careful. Like the ones you mentioned, if their content is having excessive estrogen, then probably it is good to avoid. But daily food intake, daily what we take in and out, in that the estrogen content is not very high.
Okay.
So it is always, I would suggest that if in case you are planning to have a supplement, always go through the content and see, and always show it to your doctor. Over the counter, buying supplements for a prolonged duration is ideally not recommended. If you're
Okay.
planning for a prolonged duration, consult your doctor and take it. That
Okay.
is what I would suggest.
Okay. Then what about these birth control pills that women are suggested by their gynacs? They are
Yeah.
also pumped with estrogen, right? So they are not
Yeah.
the healthiest option out there for
Uh,
contraception.
so no, it is not like that. So anything for a short duration is okay. Suppose there are various types of birth control pills that are available now. So generally, only estrogen pills generally are not given nowadays. It is
Okay.
generally a combination that is given.
Correct. Correct.
Oh.
Yeah. So that is the reason why the combination also has come in. You see,
Yes.
probably 30 years back, only estrogen was the main thing. Then they have realized that okay, it can cause all these effects. So now it is more of combination. So for a short duration, it is okay. It is not a big thing. But if you are taking for a prolonged duration, sometimes it's hormone replacement therapies. So although
Correct.
a very minor fraction can lead to it, it is not a very number one risk factor, I wouldn't say, because now all the pills are combination. So it is not the number one risk factor, but there is a slight increase in incidence.
Okay.
So always the combination pills are better. For a shorter duration, it is okay. Longer duration, only estrogen pills are not really good.
Okay. And doctor, apart from the dietary or not the dietary supplements, but self-examination, are there any other symptoms women should be aware of?
Yeah. So breast screening has basically 2 to 3 components. In that, one is a self breast examination, what we call. Other is clinical breast examination that is done by doctors. Third is the scans that we do. That could be mammogram, ultrasound, anything.
Okay.
So in self examination, what
Yes. Yes.
basically
Please go ahead. Please.
the woman herself is examining the breast. The main thing that the woman has to look is a prolonged duration of any lumps, any nipple discharge that could be bloody. So lump can be there in breast normally. It can be there in fibroadenomas. It can occur sometimes in when the lady is menstruating, what we call a cyclical mastalgia. Some of them would have pain in the breast. So that is normal. But any lump that is prolonged for a longer duration, any nipple discharge that is generally bloody in discharge, any nipple inversions, any skin dimpling, that is a something like a dimple on the skin, any skin changes over the breast, generally in technical terms we call it like beauty orange. So basically like how an orange peel looks, if your skin becomes a little hard or anything like that these are basically the signs of breast cancer. And one more important thing is that generally breast cancer will not have pain. So most of the lumps are painless lumps. It will be hard and painless lumps. If you have a lump that is there from quite some time, that is weeks to months, then it is worthwhile to get it tested. So that one point we have to keep in mind.
Okay. This is a very good point actually which you brought up. So for the past 2-3 months I had started developing some pain near my arm, like my underarms or my armpits. So
Correct.
for a second, since I also work in a cancer hospital, so the first thought which comes to me is what if it's something related to that. So it's a very good point you brought out today, saying that the lumps, or probably there'll be no pain, or it's a painless lump which actually
Correct.
develops with people who have, or who might end up having breast cancer. So
Correct.
yeah,
So
that's
one more
again a
point
very
is
valid
that
point.
among all the breast cancer lump, 70% to 80% are not cancerous. When we consider a normal incidence, if 100 people are having a breast lump, so only 20 to 30% probably are malignant. Most of them are not malignant. So that is one more point that we have to be aware that all lumps are not malignant. So people need not get scared immediately that I have a lump, I have a painless lump. So that there are various other causes for it. Only 20 to 30% finally turn out to be malignant.
Okay. And just a random question, like it suddenly just came to me, that is there a side which gets affected more, like the right side or the left side, or it's the incidence is equal?
Slightly left breast is the incidence is slightly more, and
Okay.
within the breast, breast generally when we talk, we divide it into 4 quadrants or 4 parts, what we call upper inner, upper outer, lower inner, lower outer. Generally, the upper outer quadrant has more chances, just because the amount of breast tissue is more there. That is only reason. There's no other reason. Upper outer quadrant always has when we compare to other areas, amount of breast tissue is always higher there. That is why overall statistically, location wise, that is the most common location.
All right. That feels like the perfect spot to end the first part of our conversation with Dr. Abhishek and, of course, Dr. Ankita. We spoke about food habits and the important lookouts for breast cancer symptoms. But honestly, we've barely scratched the surface. When we come back for part 2, we are going to dive into what chemotherapy is really like, the financial aspect of this disease, and what actually happens with patient aftercare. We'll pick it up right here next time. Until then, make sure you hit that subscribe button and share with us your story or concerns on breast cancer or menstruation. And check us and our work out on Instagram at code.crimson_. See you until then. Bye bye.